All right. Good evening, everyone. Am I audible to all of you? Yes, I am audible and hopefully I'm visible as well. So, I'm Dr. Tushar Mehta, orthopedic surgeon, faculty of orthopedics. I can totally understand the amount of pressure, the monotony that must be seeping in all of you right now for your coming exams for the 5th of March. It's a tough time. Most of us have gone through it. I mean, most of the faculties, all of the faculties. इस वक्त पे जो सबसे इम्पोर्टेंट चीज़ होती है वो ये होती है टू understand what is the road further for the remaining days, whatever 10, 12, whatever days which are pending. I'll tell you the dilemma that I was going through when I was preparing like you. जो पढ़ा था वो याद आ नहीं रहा था, जो पढ़ रहा था वो याद हो नहीं रहा था, और जो पढ़ा नहीं था वो याद आता कहाँ से. So whatever I had read, I was not able to recall, and whatever I was reading at that point of time, I was not able to get it into my head, and whatever was which was still pending, of course, that was pending. So at this moment, you feel as if somebody should come to you and should really put the thing into your head, and most importantly in time. This line is very important. Most importantly, in time. In time. It has to be done in time. Because what happens is, like, in the last few days, like 10 days, 7 days, 8 days, whatever. So we tend to try to finish, that every topic that we are supposed to do, or every subject that we are supposed to do, we try to finish that in a stipulated period of time. But वो होता नहीं. So we make plans, we are not able to fulfill them. Then again, we tear that plan again, and then we make another plan. ठीक है, तो ये चलता रहेगा. हम प्लान बनाते रहेंगे, हटाते रहेंगे, बनाते रहेंगे, हटाते रहेंगे. My suggestion before I begin today, these 2 hours are very, very important. Very, very important. Believe me. DVT, PYQ, yes. They are, I would say they are more important than DVT even. I would say that. ठीक है, तो इस पे हमें बहुत ज़्यादा फोकस करना है. ठीक है, I will try to compile the entire subject within a few slides. So this image is very important. I am sure you all can see this image right now. So this image is an image of something which is called as, yes, everyone. See, it's an interactive session. ठीक है, आंसर आता है, ठीक है, नहीं आता है तो भी कोई बात नहीं है, but still, I mean, I'll appreciate if you people can answer. So it's which test? Come on, tell me, it is which test? This is ADSON. All right. So the test that you are able to see, okay. So the test that you are able to see here is basically what is called as ADSON, AdSense test. Now, where do we do AdSense test? You have to understand this as well. Are fantastic. So AdSense test is something that you do in thoracic outlet syndrome. ठीक है. So AdSense test एक ऐसा test है जो हम लोग we do it in a condition that is what is called as thoracic outlet syndrome. Now, when I say thoracic outlet syndrome, what does that mean? I'll make it a little simple for you. What do you mean by thoracic outlet syndrome? So technically, there's a condition called cervical rib, okay, or there's a condition called thoracic outlet syndrome, where you have compression of the brachial plexus and the subclavian vessel hair. So these people of thoracic outlet syndrome, they have a tendency that they complain of tingling and numbness in their hands. So in this test, ADSON AdSense test, we are provocating their symptoms. ठीक है ना? We are provocating their symptoms. And when I say that we are provocating their symptoms, what does that mean? That we ask them to hyperextend the neck. We ask them to rotate the neck towards one side, on the side where you are having symptoms. And then we try to palpate the radial pulse. We can palpate it. I can feel it. And then you ask the patient to take a deep breath. And the moment patient takes a deep breath, then this compression increases even more. So by hyperextension and ipsilateral rotation, you're producing a kind of a compression on the neck. And when you take a deep breath, you're putting a little more compression. And when you're putting a little more compression, there's a complete compression over the brachial plexus and the subclavian vessel, and the radial pulse disappears. And then after taking the deep breath, you're holding it. So radial pulse has disappeared. The moment you exhale, the radial pulse reappears. At that moment, radial pulse reappears. And the moment it reappears, we're going to call it AdSense test positive. I hope it makes some sense to you. Now, moving over to the next image. See, this next image, which I want all of you to understand here, is this one. Okay, can anybody tell me what is this image? So this is basically All right, so this is basically Durkin's test. This is basically Durkin's test done for carpal tunnel syndrome, which is median nerve compression. So this is Durkin's test, which is done for carpal tunnel syndrome, basically meant for median nerve compression. Okay. Now in this Durkin's test, you have to understand what they have done is, see, they have clearly tried to press the median nerve. They have clearly tried to press the median nerve by the two thumbs of the examiner. So these are the two thumbs. I'm sure you all can see this arrow. So there is one thumb, there's another thumb. They are trying to block the median nerve with the two thumbs. They'll stand there for a period of 60 seconds. They'll be doing it for a period of 60 seconds. And if in 60 seconds the patient complains of, tingling and numbness and, 1, 2, 3, 3.5 fingers, then we will say, okay, fine. The provocative test has been performed for compression neuropathy, that is median nerve compression Durkin's test. And believe me, it is the most specific test. I mean, there are multiple tests. I'm repeating my words again. There are multiple tests for carpal tunnel syndrome. This is the most specific. Okay, this is the most specific test for carpal tunnel syndrome. This is the most specific test for carpal tunnel syndrome out of all these tests. This carries the maximum value. Faisal, PDF will be given, don't worry. Okay. Now we talk about the third test here. The one we have seen is Adson, then we have seen Durkin. Now I want you to see this. So this is what you see here is basically, and guys, PDF will be uploaded. PDF will be uploaded, so don't worry. Now this is what you're looking at right now. This is what you're looking at right now is called as Tinel sign. What do we call it? This is what is called as Tinel sign. Again, for carpal tunnel syndrome, for median nerve compression. What are they doing here? Let's try to understand. Revise it. Most of you are aware of it, but that's okay. Let's revise it also. So what are they doing here is they're producing a compression over the median nerve by directly tapping the nerve. I'm sure you can see with this finger, the examiner is tapping the nerve. He is directly tapping the nerve. He is percussing the nerve. And when you are tapping the nerve, and if that produces tingling and numbness in lateral 3.5 fingers, that is what is called as Tinel sign. I hope it makes some sense. After these three tests, let's talk about the fourth test here. I do hope that most of you give the correct answer. Can you tell me? Can you tell me all? What is this test? So this is, guys, pen test. This is basically pen test, and it is for abductor pollicis. It is for abductor pollicis brevis. So this pen test is basically for abductor pollicis brevis, and nerve supply is, come on everyone, median. Nerve supply is basically median nerve. So the tendon that you are checking is abductor pollicis, not longus, not APL. It is APB. Fantastic. Some of you have correctly answered it. So the tendon that they are checking, the tendon that they are checking is basically abductor pollicis brevis, and the nerve that they are checking is basically median nerve. Now, how are they performing this test? We have to understand that. So they've asked the patient to place the hand in such a way that palm is facing the ceiling. I'm sure you all can see that. The palm is facing the ceiling and the dorsum is facing the floor. Then I'm sure you all can see the pen. This is the biggest clue in this question. So then they have put up a pen here. So I'm sure you can see this. They are putting a pen, and what they're doing is, let me just tell you, they're asking the patient, just hold on. Yes. So so they're asking the patient to touch the tip of the pen with the tip of the thumb. So they are asking the patient to touch the tip of the pen with the tip of the thumb. And if the patient is able to touch it, then pen test is negative. If the patient is able to touch it, then pen test is negative. Median nerve is normal. Abductor pollicis brevis is normal. I hope it makes some sense. Now let's talk about the other one. Now this other one, which you have to see here, this other one, which you have to see here, this is what is called as book test. This is what is called as book test. Also what is called as Froment sign. Okay, so you're going to call it book test. Also you can call it Froment sign. You can call it book test, or you can call it Froment sign. You can call it Froment sign. Now, this book test or Froment sign is something that you should. I mean, let me just explain it to you. Why do we call it a book test or Froment sign, and what is the relevance of calling it book test or Froment sign? मैं बताता हूँ आपको. See, please try to understand. Just hold on. So, please try to understand that when we are talking about it as a book test, you actually ask the patient to hold the book, but that's not important. That's not important. मैं बताता हूँ आपको. Just hold on. Just hold on. Okay. So I will use my concept book of orthopedics that I've made specially for the students coming for the regular batch 2023 as the book. So you ask the patient to hold the book with the help of thumb and index finger. Now, what is this tendon? What is this tendon that you are using to hold the book? Adductor pollicis. The tendon that you're using here, I'm sure you all can see that. Okay? The tendon that you're using here is adductor pollicis, which is supplied by ulnar nerve. So the patient is holding the book like this. The examiner will also hold the book like this. They both will try to take it away, snatch it away from each other. And if the examiner is able to take it away, then we say that my adductor pollicis is not working. My ulnar nerve is not working. My book test is positive. My Froment sign is present. I hope it makes some sense. But I'm not that stupid that I will let anybody take the book away from me. I know my muscle is not working, but I will not allow the examiner to just take it away. So, in a compensation phenomenon, what I will be doing is, rather than holding the book like this, I hope you can see that. Rather than holding the book like this, I will hold the book like this. Can you see that? Now, when I will hold the book like this, can you see that? Now, when I will hold the book like this, I will be using my thumb and index finger again, but not with the help of adductor pollicis. Just take a look. I'll be flexing my interphalangeal joint of the thumb. So technically, I will be using flexor pollicis longus. I will be flexing the distal interphalangeal joint of the index finger, which is supplied by flexor digitorum profundus. So I will be using, in a compensation, I will be using FPL of thumb and FDP of index finger. And by the way, both are supplied by anterior incrucius nerve, which is a motor branch of median nerve. So what I'm trying to tell you, okay, let me just make it clear to all of you. Okay, let me just make it clear to all of you. Book test, okay, book test or Froment sign is basically for adductor pollicis. Okay, the nerve supply is ulnar nerve. Okay, the nerve supply is ulnar nerve. Okay, now in case you have a positive book test, so in a positive book test, okay, in a positive book test, that means which nerve is not working. In a positive book test in Froment sign, which nerve is not working? It is basically ulnar nerve palsy. Okay, or in other words, you can say there is adductor pollicis palsy. The muscle is not working. But you have to understand. That there will be a compensatory usage of. There will be compensatory usage of which two tendons to hold the book. There will be compensatory usage of FPL of thumb and FDP of index finger. Are we able to understand this? There will be usage of FPL of thumb and FDP of index finger. When both are supplied by, ये चीज बहुत important है. When both are supplied by anterior incrucius nerve, ठीक है, which is a motor branch, deep motor branch of median nerve. ठीक है जी. So you should know which nerve is actually involved. ठीक है, you should know which nerve is actually involved, and you should know which nerve is actually involved, and you should know that which nerve will act as a compensatory nerve. तो ये भी आपको पता होना चाहिए. Okay, so this is again something which I think that you people should know. Are we able to understand this? Does it make any sense to all of you? So this is the fundamental behind this whole concept here. Done? Now, moving over to the next slide. What do you think is this? Okay, now let me just speak it out for you. अरे डिप्रेस मत होइए चौधरी साहब, सामने देखिए आप. तो अब मैं क्या बोल रहा हूँ आपको, प्लीज पे अटेंशन है. So in this photograph, if you see on the left hand side, I mean onto your left, not the patient's left. So if you see on the left hand side, the patient is actually flexing the interphalangeal joint of thumb. Yes. So is he using his FPL? Bolo. What do you think? बोल नहीं रहे आप लोग. Do you think that he is using his FPL of thumb? I think he is exactly using the FPL of thumb. I don't see any problem in that. I think he is classically using FPL of thumb. I can also see, I can also see that he is using FDP of index finger. I can see that he is using FDP of index finger. इसमें भी I don't see any problem at all. So what does that mean? That on this side, मेरा बात समझ में आ रहा है? इसका मतलब क्या है? इसका मतलब ये है that on this side you have normal anterior introitious nerve or normal median nerve. This is the crux of the whole story here. Okay, this is the normal crux. The crux of the story is that you have a normal anterior introitious nerve, which is a normal branch of the median nerve. ठीक? Now, do you see on the opposite side, is the patient able to do so? No. So now what I'm trying to tell you is that this, what you see here is what is called as OK sign, the normal OK sign. Are we able to understand this? So basically, what you are looking at right now, what you are looking at right now is a normal OK sign. What you're looking at right now is called as normal OK sign. So on this side, on this side, what you are looking at is a normal OK sign. Now, when I say it's a normal OK sign, मेरा बात सुनिएगा आप लोग. When I say that it is a normal OK sign, what does that mean? That simply means that normal OK sign is seen only when you have the normal introitious, anterior introitious nerve or you have the normal median nerve, तभी आपको normal OK sign देखने को मिलेगा. Are we able to understand this? Are we able to understand this? Now, if you see on the opposite side, ठीक है? If you see on the opposite side, you are going to see a weak OK sign. दूसरी साइड पे जब आप देखोगे, you are going to see a weak OK sign here. You are going to see the weak OK sign here. Now, this weak OK sign will be seen due to what? AIN palsy. This is also called as Killow-Nevin sign. So this is also called as Killow-Nevin sign. So this is a piece of information which is quite vital. This is one piece of information which is considered to be quite vital. On the normal side, you have this. On the other side, you have this. Are we able to understand this? Are we able to understand this? Yes. So weak OK sign. So weak OK sign is basically, weak OK sign is basically due to AIN palsy. Done, everyone? Chali. Moving over to the next one. So on the image on the top, you can see palmar introitiae, whose job is to do adduction of the fingers. Okay? Whose job is to do adduction of the fingers. Are we able to understand this? Are we able to understand this? Adduction of the fingers, which is supplied by palmar introitiae, again ulnar nerve. The dorsal introitiae are responsible for abduction of the fingers, again, which are supplied by ulnar nerve. So now we are not going to use a book, we are going to use a card. So this is a card. The examiner will hold it between the middle and the ring finger. The patient will hold it between the middle and the ring finger, and if the examiner snatches it away, so that means what is not working? Adduction is not working. Ulnar nerve is not working. Palmar introitiae are not working. Card test is positive. If you see the other image, if you see this image, so here you're asking the patient to spread out the fingers against the resistance. Are we able to understand this? You're asking the patient to spread out the fingers against the resistance. So if you are putting the resistance against the thumb and the little finger, or the index and the little finger, and the patient is able to do this, so that means which movement is possible? Abduction is possible. Ulnar nerve is possible. Igawa's test is negative. Are we able to understand this? So basically, यहाँ पर आपको जो चीज याद रखनी है, the simple is a very very simple thing. So you are checking card test. You are checking palmar introitiae. You are checking ulnar nerve. All right. You are checking ulnar nerve. You are checking which movement of fingers? Adduction of fingers. So this is basically what you are looking at right now in this image. I hope it makes some sense to all of you. Now, if you see here, if you see here, then obviously, again, as I said, it's just the other way around. So this is basically Igawa's test. Okay, so this is Igawa test. Here you are checking dorsal interossei. Here you are checking dorsal interossei. You are checking ulnar nerve. You are checking abduction of fingers. All right. So ये जो है, this is basically what we are looking at here right now. I hope it makes some sense to you. So this is what we are checking here in this image. So far so good. So far so good, everyone. Chili. Now moving over to the next test here. Can you tell me what is this test on the left hand side? Can you tell me? Can you all tell me what is this test on the left hand side? Can you all tell me what is this test on the left hand side? So, dude, this is basically Thomas test. Okay, this is basically Thomas test. We are flexing the hip, and while flexion of the hip, if there is an exaggeration in the lumbar curvature, मेरा बात समझ में आया? If there is an exaggeration in the lumbar curvature, if there is an exaggeration in the lumbar lordosis, that is when we say that flexion deformity of the hip is there. Okay, now this is something which I want you to understand. See, when you have a very limited time, listen to this advice. When you have a very limited time and you have to revise everything in one shot, please try to understand that in your exam, nobody is ever going to ask you that for 5 marks perform Thomas test. कोई नहीं बोलने वाला. Nobody will ever ask you draw a well-labeled diagram of Thomas test. No. Nobody will ever ask you that describe the steps of Thomas test. Right? Either there'll be a photograph image or there'll be a video. Most likely it'll be an image, picture. You have the image, you have the picture. Now, what you people tend to do